I'm actually presenting on this topic at our annual Tandem conference in Salt Lake City in a couple of weeks. And so we know that patients who have large B-cell lymphoma who fail CAR T therapy have a very poor median overall survival. Really in the literature right now, median overall survival is about less than 6 months from time of CAR T failure. And we know that for select patients with relapsed refractory large B-cell lymphoma, allogeneic transplant does have curative potential. Most studies in the pre-CAR T era have about a 3-year progression-free survival of about 36 to 38% in these patients. But despite this, we really have minimal data on feasibility, efficacy, and toxicity. And yet we know many of our colleagues are considering or using this option. Really, the data we have is currently limited to series of less than 10 patients, 2 studies with less than 10 patients. And so what we did was we performed a multi-center retrospective analysis looking at these patients. And really, we took a look at 18 centers. And of 18 centers, we had 88 patients. So just telling you how single center analyses are limited in this way. So firstly, describing the patient characteristics of this population. We'll go over the age, what their demographics are, how many lines of therapy they had prior to CAR, in addition to, what their best response to CAR T therapy was, which I'll go over more in depth in my talk. Some of these characteristics are similar to patients with relapsed refractory large B-cell lymphoma overall, with median age being in the 50s, patients overall having, favorable characteristics. But also we're going to be going over 1 year PFS, OS, non-relapse mortality, and progression and relapse. So given that our follow-up was only 15 months, we limited our outcomes to 1-year follow-up. So briefly, we found that 1-year overall survival was around 60%. So similar to what we've found in the pre-CAR T era. 1-year PFS was 45%. And then 1-year non-relapse mortality was 22%, with progression and relapse at 1 year being 33%. Importantly, we also report on neutrophil and platelet recovery. And so importantly, neutrophil and platelet recovery were similar to what we found in the past. So median time to recovery was 16 days and 18 days for neutrophils and platelets, respectively. And there was really only 1 case of primary graft failure, so that was not a major issue. And lastly, I'll go into the predictors of inferior outcomes in this group of patients. The main points that I'll be addressing in my talk is that on multivariate analysis, what we really found, the main 2 drivers of inferior outcomes were not being in a complete remission prior to allogeneic transplant. So we saw a very strong signal for patients not in CR having worse outcomes, with patients in PR, stable disease and progressive disease at time of transplant having worse outcomes. And we also found that patients who received 2 or more lines of therapy intervening between their CAR T failure and their allo transplant also did have worse outcomes. And so I'll go more into those points on my talk as well.